This study born on the lack of the evidence about the dose of paclitaxel after DCB in human. Thanks to the work with Luciano Piubelli and Loredano Poleggioni from the protein laboratory at the University of Insubria, we developed this study. With a HPLC machine is possible with very it's possible to dosage very low concentration of paclitaxel after DCB. It's very important for the safety of the patients and for an analysis of the washout of the drug from the balloon. Today, the maximum dosage in our patients treated for neointimal hyperplasia in AV fistula is 20 nanomolar liter, so a concentration very low if compared with the dosage of the paclitaxel tolerate in men. And for the principle of dose effect, if you don't have dose, it's impossible to thinking about a systemic effect. So it's very important. This study is important from my side about 2 points. First, the safety of the patients, because the paclitaxel today is a cure of neointimal hyperplasia or the stenosis in atherosclerotic lesion and don't produce damage on the patient. The second point is this. Not all the drug-coated balloon is similar. Yes, the drug is the same, but the coating, the excipient is very different. And these methods allow us the study of wash out the drug from the balloon. So it's very important for us to see the part of drugs lost during the navigation and in the blood of the patients. I start my utilization of drug-coated balloon in 2013 with Aperto by Cardionovum. I never stopped in my clinical practice the use of drug-coated balloon, also during the storm produced by paper of Katsanos, because the clinical result is very strong, not only in my clinical practice, but in the literature, in published, and the safety of the paclitaxel today don't have doubt. With my study, probably also from a pharmacological point of view, we have another very important evidence about this point. The safety for the patients is fundamental in medicine. Each procedure is necessary to perform with safety for patients. But today I don't have doubt about safety of paclitaxel and on efficacy of paclitaxel in the treatment of neointimal hyperplasia and other stenosis, for example, in peripheral or coronary artery. So the use for me is mandatory in this cohort of patients. Of course, another fantastic point of view. Naturally, we start from the AV fistula, but we work today for other part. For example, peripheral artery or coronary artery. And it's very interesting because hemodynamically it's very different. In AV fistula we have a vein with high flow and low pressure. Peripheral artery is a location with high pressure but low flow. So probably it's very different, the dosage of paclitaxel. Another point of view, we use different balloon, very thin in peripheral but very long. So the dose of paclitaxel is higher in peripheral artery. It's mandatory to perform this analysis in peripheral artery and coronary for increase the evidence about the safety and the role of Safepax in the release of the drugs also in the lesion and not in the blood losing.